It's another busy week for AI and healthcare news. Hey, I'm Ryan Flynn. I'm a former Bloomberg biotech reporter and current healthcare communications consultant. And I'm sharing with you some news stories that caught my attention this week about how AI is changing healthcare. Number one, investment has surged tremendously for AI healthcare companies this year. In 2024, the number increased about 40% as venture capitalists fund things like predictive tools that can cut surgical cancellations, and which saves a lot of money for hospital systems. And it just shows in general how AI is becoming a much more important part of the healthcare investment community. Hospitals, another area where we're seeing a lot of attention in this. I find this interesting. China is doing preparing to launch a self-evolving, quote unquote, virtual hospital next year. It's powered by AI and it simulates everything from diagnosis to treatment and uses AI doctors trained on real cases to handle tens of thousands of cases or patients a day. So China's surging ahead with its virtual hospital center, which would be really fascinating. Mental health, another important story here. I found this article about an app being used, AI driven app in Mexico to help prevent suicide. And the app was able to reduce suicide rates by 9% through early detection and intervention. It uses AI to analyze responses to mental health questions, and it assigns risk categories. It has 80,000 users already, and it's a really interesting approach for a topic that people have, issues with talking about publicly or friends or family. So this type of approach could really help save a lot of lives. For mothers and babies, AI is being used in different ways. One I thought again just caught my attention is about a company developing a thing called Placenta Vision, which allows AI and vision software to analyze the placenta of newly born babies, and it looks at potential signs of infection, other warning signs that maybe a doctor might miss visually. So kind of an interesting approach. There's another app also called Her, MOT, her, and it's giving new mothers guidance through postpartum recovery. Again, another issue where a lot of people might have questions and not know where to get resources. So it's a good way for them to get that help. And then finally, the story that I probably think is my story of the year. I just think it's so hilarious. This is a AI tool that it looks at X-rays and looks for potential health issues. And what they found was this software had analyzed 25,000 knee X-rays, and the model not only predicted like conditions and whatnot, but also was suggesting lifestyles and habits of patients that were totally unrelated. So, for instance, the AI software is like, yeah, this guy has osteoporosis, and he's also a beer drinker. Like, the doctors are like, this is totally like unnecessary and unusual. But it just shows how AI is being used, or it can actually come up with different traits and habits that were actually true. So, another funny look at just how AI is being used in healthcare. Hope you enjoy. I'll leave a link to the whole newsletter with 10 articles in the comments, and see you next week.